Hello, I'm Cindy Arenberg Seltzer, President and CEO of the Children's Services Council of Broward County. Welcome to another edition of Future First, Focus on Broward's Children. Childhood and adolescence in particular is fraught with drama and emotional highs and lows. The stresses related to hormonal changes, existential questions, peer pressures, the development of self, and the rebelliousness that often comes with adolescence are some of the challenges faced by youth. Sometimes, however, the expected rite of passage crosses a line into what must be addressed and treated as possible mental illness. Nearly 5 million children in the U.S. have some type of serious mental illness, one that significantly interferes with their daily life. In any given year, 20% of American children will be diagnosed with a mental illness. There are many factors involved in understanding and treating mental illness in children and youth. Today, in anticipation of May, Mental Health Awareness Month, and May 8th in particular, Children's Mental Health Day, we will explore symptoms, resources, services, and support systems that can help children and families engage effectively with questions related to mental health. Here to discuss these issues are Paul Jaquith, President and CEO of the Mental Health Association of Southeast Florida, Dr. Laurel Thompson, Director of Student Services of Broward County Public Schools, and Joanne Correia-Kent, Co-Director of Smith Community Mental Health. Welcome to you all.
Thank you.
Thanks so much for being here.
Sure.
Paul, I want to start with you. There's actually a day, May 8th, to talk about children's mental health. Why is that, and what do you hope to see happen as a result of that?
Well, it's really important that we raise awareness, that we take an opportunity to step back and recognize that mental illness is not a dirty word. It's not necessarily a negative thing. There's hope, there's opportunities for people to get help, and it's an opportunity for us to put on the table the opportunity for a discussion. If nothing else, the day makes that happen. Every day should be a mental health awareness day, but certainly having a special day gives that opportunity to really put the focus on it, and put the spotlight on what's happening. As you said in your intro, 1 in 5 children, 1 in 5 adults are affected by it. So it's really an opportunity for all of us to step back and to recognize that and to do something, intervene wherever we can.
And how are we intervening? I mean, I know back, it's actually a very personal thing for me and my family. My aunt suffered from bipolar disorder and my mom from some pretty severe depression. But back in their day, there really was very little understanding and very little that can be done. I think a lot of advances have been made since then. Mm-hmm. Joanne, I know you're involved in dealing with that to a great extent.
Certainly there's a lot of stigma around mental health and mental illness, and people may have been fearful about reaching out for help. Now there are community mental health centers, private psychiatrists, some medications that can really be helpful in helping people to feel stable, comfortable, and productive. So it's really important that people reach out and take that, open the door, take that first step, ask for help.
And the Broward County Public Schools are trying to make that easy, right, Dr.
Yes,
Thompson?
correct. Broward County Schools, we're very concerned about the whole child. And in order to assist families, we have many services available. We have our trained, licensed clinical social workers that are in every school. We have a family counselor in each of our zones, a trained person that sees the family and the children, because sometimes mental health goes between the family and the children. We can treat the children at school. They go home to an environment where the families are not treated and their needs are not adequately addressed, then the kids regress. So we see the whole family, and we have services that we provide for them after school hours, so the families can come after their work hours, and so we make those available. We know that if children are not their needs are not adequately met, they cannot come to school ready to learn. They will be in school, but not ready to learn. And mental health among our children is a rising phenomenon that we must address.
I think, one of the other things that we look at, mental health is kind of, it conjures up all kinds of thoughts and opinions and feelings about what does that mean. And one of the things that we all try to do is to demystify it. The latest research shows that the brain is part of the body. which is remarkable. You know,
Who knew?
when you look at diabetes, heart conditions, any kinds of what we call physical health issues, somehow those aren't stigmatized. Right. But mental health is. Mental health in many parts is still seen as a weakness or something that someone participated to bring it upon themselves. So, you know, part of the awareness campaign is to help people recognize that there are a lot of reasons and a lot of things that happen to someone when they become mentally ill, when they become diagnosed with a mental illness, and it's not necessarily that that's the end of the road. We know through research that the earlier an intervention happens, the better the outcome, by far, not just a little bit, by far. So there's no advantage, for example, for a caretaker or a parent to recognize that there's something off about their child and not taking the steps to at least get an assessment, which would be really the first step in the process, is to begin to identify what's going on with my child. And there's a lot of fear about entering the system and a lot of concerns about that, and we all understand that. But the flip side of that, by not doing anything, is not helping. It's actually making the condition worse.
Well, you know, I'm the mom of a 7-year-old, and there are times I often think, she's nuts. And I know the moms of all of her friends, and we get together and we're like, these kids are crazy. I mean, they're bouncing off the walls, they're doing pretend play, so they're talking to themselves, they're twirling. I mean, they're doing a lot of things that really are normal, developmental, even as we as adults in our adult head would go, what's up? So how do you know when it crosses that line? Or we talked before about adolescence, all those hormonal changes and the lashing out and things that, you know, your sweet child now becomes a little crazy, but it's normal. How do you know when to tell that they should get an assessment?
You know, I think in years gone by, we had a much more extended family, and we would talk about what was normal, what was developmentally normal for a child, and we could talk with our friends, and we tend to reach out, I think, less than we used to with extended family and friends. However, Paul made an excellent point, is that eventually you've got to come to a point where you're going to request an assessment. You're going to have your child assessed by a professional who understands normal developmental milestones and can help guide you in the right direction as to whether some intervention needs to take place or probably could take place, or whether your kid really is in the right ballpark. Remember, every child is unique, so a child may be demonstrating some symptoms that may seem a little outrageous, but based upon their culture or based upon what's going on in their family at that time, could be a very normal response. So getting that assessment really can bring peace of mind to families, to have an understanding of what's going on with their child.
And I think something to bear in mind also is frequency of the behavior and duration of the behavior. I think those are two things people should think about. If it's going on for too long, it might be an indication something is wrong. Or if it's too intense, it's time to get some intervention and see if something is really wrong with the child. And it's very hard sometimes in the school setting to see the behavior and decide, is this typical behavior or is this a troubled behavior? And so we've been training our school staff on a curriculum we call typical or troubled. And what that says is, first you notice the behavior. When you notice a behavior, then you talk to the child. So what's going on with you? Why are you acting this way? And then you do something about it, you act. So you notice, you talk, and then you act. And that's what we've been teaching our schools to do. And I think that's been working rather well.
You know,
I think the other thing, I'm sorry, the other thing to look for is any family history. You know, sometimes someone will say, oh, you know, I remember my Aunt Sadie used to, fill in the blank. And then someone else in the family might say, oh yeah, well, you know, she had this problem that no one talked about. And to Joanne's point about in generations and cultures past, things were handled in a different way. You know, nowadays when kids are in school, there's a lot more emphasis on how's the child performing, what's their level of developmental skills, and where are they in relation to other kids. And I think the easiest way for any parent to kind of look is to see what are other kids doing on the playground or in the school, and are they kind of in the same ballpark? You know, not every kid is going to be the same. There are some kids that are more gregarious and some kids that are more withdrawn. That doesn't mean they're depressed.
Right.
It just means that's how that child is. So it's not about panicking unnecessarily, but to recognize, and most times, you know, when you talk to a parent when they brought the child in, they said, you know, I thought there was something wrong, and I couldn't quite pinpoint it. I didn't really know, but I thought there was something. And I always tell parents, you got to listen to that little voice inside that tells you, maybe I need to just get this checked out.
And many times, those responses for how to support a child are very normal things, like perhaps the child needs to get more involved in sports or karate or something that can help that child with, perhaps that child tends to be more withdrawn, and perhaps that'll help the child come out a little more. So the fix may be something that we see as very normal, more involvement in groups, more involvement in other things to help support that child in areas to grow in normalcy, so that they will grow through their developmental stages in a healthy way.
Well, I think that sharing with other parents is also important, because so many parents now are parents of, you know, one child. In the old days you had, you know, 10, 8, and now it's 1. And so, and they may be afraid to ask their friend about, what are you seeing with little Debbie or Joey? And once you actually do share, you find, oh, I guess all of the kids are doing that now. I thought it was just her that was out of whack. But if you do feel like, well, maybe that gut level thing is right, who do you call? Who do you ask? Where do you go for that assessment?
There are many opportunities, many different places. We have from the schools to community mental health centers. Many people are insured. They need to reach out through their own insurance. So
for a psychiatrist, a psychologist, a behavioralist, what are you looking for to get an assessment?
Generally, an assessment can be done by either a psychiatrist, which is a physician, or it can be done by a licensed mental health professional. Almost every community mental health center has a licensed mental health professional, and almost all community mental health centers will do an assessment.
And the assessments can be done in the schools as well, because we have licensed clinical social workers. We have our family counselors who are all licensed as well. And so they can do an assessment on the student as well. And then in our family counseling programs, we can see our families for 12 weeks, 12 sessions that can be stretched out for 12 weeks, or it can be stretched out for several months, but 12 times based on our contract. And then if we decide then the child needs something further, we refer the family elsewhere to a Smith or to a Chrysalis or one of those other agencies. One thing that we saw early on, several years ago, is that we have families, because of the stigma attached to mental health, we had families who we know their children needed some help, and we would refer them to, say, an agency in the community. But they wouldn't go. They wouldn't go because of access. It could be transportation. It could be just the stigma attached to it. So we decided we need to bring the service then to the school, so our students can have the service while we have them in school as a captive audience. So we developed the behavioral health partnership, where we have partnership with Henderson and Smith Mental Health and several of our agencies. And you know, we vet them and make sure the people they have, their staff are well trained and prepared to deal with our children. They go through all the screenings, and once that's done and they sign the paperwork with us, then they're allowed to come into school and see the child during those non-academic classes, so they can get the counseling they need right there on campus. Of course, we use our in-house people first, and then when we have that overflow, we call in the agencies for assistance. And we really appreciate the partnership we have with you guys in working so hard in providing services for our families.